So welcome everyone, and thank you so much for being here with us today. I wanted to introduce myself. My name is Iman Judah, and I am the representative for the 41st House District in Aurora. And I want to take a moment just quickly to remember to mute yourself if you are not talking. So today I'm here with members of the Coloradans for Affordable and Dependable Healthcare Coalition, which includes over 50 organizations supporting HB 1370. This critical bill will implement common sense consumer protections and lower out-of-pocket healthcare costs for Colorado families. When families cannot afford necessary care or guarantee their insurance coverage will be there when they need it, the consequences can be dire, particularly for those living with chronic conditions who require consistent care just to get by in their day-to-day lives. I've been very public about my own lived experience with epilepsy, and I have firsthand experience with how critical it is to be able to get the medications my doctor prescribes to me without jumping through hoops put in place by insurance carriers. Too often for me and others, high pocket out of costs and red tape stand in the way. This can be dangerous, and for me, it has put me at risk of having seizures and ultimately putting my life at risk as well. House Bill 1370 makes common sense reforms that will bring integrity and fairness to our healthcare system, save Coloradans money on prescription medications, and improve healthcare outcomes in our state. This bill will reduce out-of-pocket costs by preventing insurance companies from pocketing prescription medication rebates, instead making sure cost savings go to consumers. The bill also bans insurers from dropping medications from coverage or raising prices in the middle of a consumer's contract. It will also reform step therapy protocols to limit a harmful practice where insurers force patients to try and fail alternative medications before covering the medications that are recommended by their doctors. Finally, HB 1370 increases consumers' ability to plan ahead for expenses by requiring more plans to have predictable costs through set dollar amount copays rather than unpredictable percentage-based payments. This bill will help bring our healthcare system in line with Colorado values by prioritizing patient health and access to care over corporate profits, and help Coloradans get the care they need to keep themselves and their families healthy. With that, I would like to introduce our first speaker and my co-prime sponsor of HB 1370, Representative Emily Sirota.
Thank you so much, Representative Judah. I am Emily Sirota, State Representative from House District 9 in Southeast Denver. And I appreciate everyone joining us today. I am so proud to be here with some incredible advocates and my fellow bill sponsor, Rep. Judah and Senator Winter. House Bill 1370 is an important step toward creating a healthcare system that puts Colorado families first and prioritizes patient health. We know that 53% of Coloradans are worried about being able to afford prescription medications, and 45% of the people in our state have put off a medical procedure or treatment because an insurance company denied it, it was too unaffordable, or they could not get services where they lived, according to a recent poll. Healthcare and prescription medications are simply too much to pay for many Colorado families. And no one in our state should have to choose between getting the health care they need or putting food on the table. That's why I am so pleased to sponsor this bill, which makes critical reforms to our healthcare system in Colorado to reduce out-of-pocket costs, cut red tape that stands in the way of better healthcare, and make sure Coloradans can depend on their coverage. Medications don't work if patients can't afford to buy them because their insurance company dropped coverage for their prescription medication or raise the price in the middle of their contract. This bill will ensure Coloradans can get what they pay for when they sign up for insurance coverage. House Bill 1370 will also help Coloradans get the medications they need by reforming step therapy protocols that require patients to try and fail alternative medications before getting coverage for the medications their doctors recommend. Doctors are the experts when it comes to the health of their patients, and they should decide which medications are best for their patients, not insurance companies. The bill will also result in a major reduction of out-of-pocket costs for Coloradans who rely on expensive medications by ensuring that pharmaceutical rebates go to consumers and not into the pockets of middlemen. Many Colorado families are still struggling to recover from the pandemic, and healthcare costs are a key culprit when it comes to financial instability. In addition to the financial devastation of the pandemic, many Coloradans are struggling with their health more than ever before. It's our job as legislators to pass legislation that provides much needed relief for families, and this bill will do just that. We have a huge opportunity this year to save Coloradans money on healthcare and improve the quality of care in Colorado, and I am proud to work alongside my fellow bill sponsors, Rep. Judah, Senator Winter, and Senator Buckner to pass House Bill 1370 to build a better healthcare system that prioritizes patients over profits.
Thank you, Rep. Sirota, and it's such an honor to be on this with you, and I'm sure, and I know everyone from our coalition is incredibly grateful for that. Next, it is my distinct honor to represent our Senate sponsor, one of our Senate sponsors, Senator Winter, and I want to thank her for her leadership in the Senate and for taking this on with us. Senator Winter.
Thank you. I'm so happy to be here with you all today. I'm proud to be sponsoring this bill 1370 to help control out-of-pocket costs for healthcare and bringing families fairness to our health insurance industry. And the reason that I joined the bill was really about the patient stories that we're hearing and the consumer stories we're hearing. And I come to this also because of my personal story with my sister who has multiple sclerosis and has found prescription drugs that have maintained her MS for nearly 9 years. But about every other year, the insurance companies try to get her to change that drug regimen when we know that her MS is in control. I've personally loaned her money. I've spent hours on the phone with insurance companies, making sure that she has access to the prescription she needs. And that's why I'm going to share a story from another patient today that mirrors my experience, my sister's experiences, Rep. Jodah's experiences. And this is why this bill is so incredibly important. So this is from a patient named Dawn Rapola. She lives in Jefferson County, and she says, I apologize for not being with you in person today. I'm in the hospital. It's a place where many people with chronic diseases spend a lot of time. I live with pulmonary fibrosis. That means my lungs are scarred and I use supplemental oxygen to breathe. After losing 12% of my lung function in 2018, my life's been consumed with managing my condition and getting the health care I need to simply breathe. Things went from bad to worse when I caught COVID. I lost 17% of my lung function and went from only needing oxygen at night and when I exercised to needing it all the time and being listed for a lung transplant. People like me who have chronic conditions are constantly working to manage their symptoms, and that means they're hugely reliant on their health coverage just to get by their day-to-day lives. They're also keenly aware of the flaws in the system. Not only are essential healthcare and prescription medications often completely unaffordable, but coverage can lack dependability. Too often, my time and energy are spent battling with health insurance companies to get the coverage I need. House Bill 1370 would make a big difference in my life and the lives of many Coloradans who struggle with their health. It would save us money on the medication we rely on, ensure medication can't be dropped from coverage, and require more cost transparency so we can plan ahead for our health expenses. If House Bill 1370 passes, Coloradans like me will be able to focus more on what matters in life, staying healthy, spending time with our families, and leading happy, productive lives. Thank you to the bill sponsors for bringing this critical piece of legislation. So for folks like Dawn, who's in the hospital right now and couldn't join us, to folks like my sister, who's also named Dawn, being able to make sure that they're spending their time staying healthy and not spending their time on the phone with insurance companies and being able to control their own health destiny.
Thank you, Senator Winter. It's so important that we hear from Coloradans and their lived experiences. And thank you for sharing Dawn's story and your sister's story. I think that's what really helped us as lawmakers understand what's going on. Next, I would like to introduce and welcome Dr. Costello to speak with us today.
Hi, thank you for having me. My name is Lori Costello. I'm a family doctor living in Durango. As a physician, I welcome efforts such as HB 1370 to rein in high healthcare costs for everyone. Many Coloradans cannot get the care and treatment they need because of runaway out-of-pocket medical and prescription drug costs. Many Coloradans are forced to delay care because they simply can't afford to pay their medical bills. Patients with chest pain skip treatment because they fear they have heart disease that will end up costing them tens of thousands of dollars out of pocket, possibly leading to bankruptcy. Patients with cancer fear their insurance company won't keep their promises to cover the full treatment they need. People with diabetes, COPD, arthritis, and a whole list of other chronic manageable conditions are skipping care that would significantly improve their health and their lives if they could afford it. They worry justifiably that they'll be on the hook for expenses far beyond what their insurance companies say they will pay for. Requiring a set dollar amount and not a percentage of the cost of care benefits patients and families because they will know ahead of time what they have to pay. Ensuring that life-saving medications won't be dropped from coverage, as happens all too often today, means patients won't be surprised to find out at the pharmacy window that the medication they need is no longer covered and is unaffordable. HB 1370 prevents insurance and drug companies from gouging patients by increasing transparency and by providing accountability that protects people. As a physician, this bill allows me to do my job of caring for and treating patients with the best evidence-based medicine at our disposal. Doctors, not insurance corporations, should be the ones determining the care their patients receive. Instead, Coloradans are forced to bet against their own health, paying high insurance premiums just in case they get sick. If they do get sick, out-of-pocket costs can be devastating. For these reasons, we urge our legislators and policymakers to put patients ahead of insurance profits and make HB 1370 a reality for Coloradans.
Thank you, Doctor. Again, always great to hear, especially from our doctors who are treating folks that have to go through this. I also wanted to introduce Myra Hansen, who will be sharing her story with us today.
Good afternoon. My name is Myra Hansen. I am a teacher living on the Eastern Plains. At 39, I was diagnosed with von Willebrand disease, a rare bleeding disorder in which my blood doesn't clot properly. An injury for me can lead to serious bleeding, organ damage, and in some cases, death. In fact, I have had bleeding so severe that I have died and been brought back to life. Unfortunately, the medication that works best to treat my condition is very expensive, and getting insurance companies to cover it can be a battle. I've had to go without medication because I could not afford it, and it took me weeks to recover from a bleed and damage to my body. Even with the coverage I have, I can never plan on how much I'll have to pay. I pay 20% of the cost of Humate-P, which is my medication, and that creates cost variances impacting my budgeting. I can pay $75 one week and $250 another week. Making matters more complicated, insurance companies have forced me into step therapies to try other medications other than Humate-P that helps me clot. When those medications fail, the insurance company finally allows coverage for the Humate-P. I have been told by an insurance company to have major abdominal surgery without Humate-P and see if I have a bleed because they wanted proof of a bleed. That was terrifying. Unfortunately, I've had to leave a job I love to find insurance that covered the medication I need to survive. Navigating insurance coverage is daunting at best. It sometimes takes hours on the phone to get the answers I need for costs and coverage. There's very little transparency, and I've had coverage change during the contract time. This is very stressful, and the energy required to go through the emotional upheaval of ensuring coverage of care is detrimental at best, not only emotionally, but also physically. House Bill 1370 will reform step therapy protocols, create predictability in prescription and healthcare costs, and promote financial transparency in insurance companies in Colorado. Lawmakers in our state have taken big steps to make healthcare more affordable and increase access, but we need to keep moving forward. For many Coloradans, myself included, access to affordable medications and dependable healthcare coverage is a matter of life and death.
Thank you so much. And I think I can speak for all of us when I say I'm so sorry for your condition and what it's like to live with that. Next, I want to welcome Rebecca Gillett, our final speaker, and certainly, you know, I hope she can drive the point home and tell us what's great about this bill.
Thank you, Representative Judah. Thank you for the opportunity to share my story. My name is Rebecca Gillett. I'm an occupational therapist and arthritis patient that lives in Centennial, Colorado. I'm happy to be here to support House Bill 1370 that I think will help Coloradans like me get the care that we need. Unfortunately, I've experienced the many flaws in our healthcare system firsthand. At 26, I was diagnosed with rheumatoid arthritis. But before finding the medication combination that worked for me, it was very debilitating and impacted my daily life, limiting my ability to use my hands, to walk, to take care of myself, and take care of the new home I had just purchased. Finding prescription drugs that helped me manage my symptoms without causing unwanted side effects was a big battle. But eventually I found the combinations that worked well for me. For almost 8 years, the combination therapy I was on worked very well to treat my pain and allowed me to go about my life, and at one point even put me into remission. However, that all changed when I decided to start a family and had to go off of my medications for family planning and pregnancy. When I was ready to start taking my medication again after nursing, the insurance company refused to approve my medication, even though I had a great track record of almost 8 years successfully on that biologic medication. Instead, with no regard for my medical history or my patient experience or my doctor's recommendations, the insurance company forced me through step therapy. And for close to 3 years, I was forced to try a variety of drugs that my doctor did not initially recommend in order to get back on the drug we knew worked best in the first place. During that time of limbo, I developed a variety of other additional health conditions, including cardiac issues, high blood pressure, and asthma, all which were likely caused by uncontrolled inflammation in my body. The nonsensical step therapy protocols wasted my time, added progression to my disease, and caused a variety of other health problems, which required me to have additional specialists to see and additional medication to take. So it's worth asking, did step therapy really save my insurance company any money in the end? No, it did not, nor me. And step therapy compromised my health, gave me additional chronic conditions to manage for the rest of my life. And unfortunately, I'm not alone in this experience. We need to reform our healthcare system so that Coloradans like me aren't forced to jump through medically unnecessary hoops just to get the care that we need to live our lives. House Bill 1370 is a common sense policy that will save Coloradans money on healthcare and prescription medications. It will also improve health outcomes and remove red tape that prevents doctors from providing the best care possible to patients like me. Thank you to the bill sponsors for bringing this important piece of legislation forward. And I ask for all Colorado lawmakers to support House Bill 1370 to build a healthcare system that prioritizes the health needs of patients. Thank you.
Thank you, Rebecca, and I apologize for mispronouncing your name. I also want to thank everyone who took the time today to tell their own stories. Again, I can't tell you how many times I have testified for years and years, and now that I'm on the other side of that bench, I know that hearing these lived experiences can change a vote. a lot of votes. And sometimes that means getting that bill out of committee. So it's really important that we hear these stories and these testimonies, because again, this is what gives these lawmakers and people a voice and help them vote based on how Coloradans are living. So with that, I wanted to open it up for questions. And so please feel free to put your question in the chat or raise your hand. And I know Marianne has a question, so let's start off with you.
Okay, there we go. Good afternoon. Thank you very much. I have two questions to start. The first is, where do you see, how does this bill, I know it repeals the current step therapy process, but it also talks about a new process for step therapy. So how does this bill envision that new process? The second is, I heard the repeated comments by several folks that this will reduce out-of-pocket costs. However, what I'm hearing from the insurance company is it's going to raise premiums instead. So are you folks comfortable with having higher premiums at the instead of having in exchange for lower out-of-pocket costs?
Thanks for the question. So I'll take the first one. So just to be clear, we are not getting rid of step therapy. What we're doing is step therapy will be the default, but what we are doing is saying, listen, if your doc knows, in my case, Depakote didn't work and Keppra didn't work. I had seizures on those, but my doc did know that lamotrigine was right for me. If that doc knows, they should be able to apply for an exemption so that they don't have to put their patient through step therapy. And again, in my case, putting me at risk of having a seizure or putting my life at risk, it's dangerous. And so that's the key point about step therapy. And I think there's a lot of misunderstanding around what will happen with step therapy, but again, we're not getting rid of it. It will be the default. Commissioner Conway, I know you're on the line. Did you want to take her second question?
Okay, now I'm unmuted. Good. So, Marianne, I think that the answer to your question, the second question, is that the sponsors have worked extensively with the carriers to understand their concerns and are opposed to run amendments to deal with those concerns, a number of those concerns. And those are issues that we've been engaged in, and we're excited to see where the bill ends up. And we're very supportive of the bill because we're confident that the sponsors are doing this for all of the great reasons that you just heard everybody talk about, all of the great reasons that we're going to be able to help consumers and patients moving forward.
That really doesn't answer the question about higher premium costs. Can you address that, please?
So, Marianne, I think the answer to the higher premium cost part of the question is that is planning to be addressed in the amendments that the sponsors are planning to run. Whether that's today or it's future hearings after we have more conversations, after they have more conversations with carriers. I think, as they have said time and time again, their intent here is not to raise premiums. And that's obviously something that we're very engaged in as well, but we want to make sure that we get this bill through.
Whoopsie.
Did we lose you, Commissioner? I know what he was, going to say. We're dedicated to, getting it through committee, working with them. And again, it has always been our commitment as bill sponsors to not raise premiums. It is not our intention to undo anything that the Colorado option did last year. Dr. Costello, I see that you had your hand raised. Did you want to comment?
Thank you. Yes, may I make a comment? I said at the end of my testimony, the concept of us living in fear that something's going to happen to our health. We pay high premiums for insurance that then doesn't cover us when something happens, or for patients with chronic diseases, there's always more costs that aren't covered. And to be threatened with an increased premium when premiums are already completely out of control and our quality is already well below accepted standards, not just in the state, but in the country, is absolute manipulation of the people of Colorado with fear. And I reject it completely. So if any insurance company is saying, well, if this passes, we're just going to raise your premiums and pass our costs on to the consumer, they're passing their profits on to you, getting their profits off of your back. So Mary Ann, be very clear about these threats, please.
I don't know if I see any other folks have their hand raised or put any questions in the chat. And if not, please.
I do have additional questions. Those were just my starts.
Oh, okay. Just know we have just a couple minutes left before we have to break.
Got it. I'll limit this to the last question. There's been a concern raised that this is just a big gift to big pharma who makes these very, very expensive drugs. How do you respond to that?
I know this has been a, quite frankly, a play by insurance companies to say this is a big pharma bill. And I want to be clear, once again, it is not. This is a bill to save consumers in Colorado money on their healthcare costs, especially on medication. And I think folks who dig into the bill and especially see the amendments, they would have a comprehensive and holistic understanding of what this bill actually does. Mary Ann, we are committed to bringing these amendments forward. And again, please understand that this is not by any means a pharma bill. And I know that has been a rumor, a misconception, and I'll be honest, it's a lie. So again, this is not a pharma bill. I encourage you to read the amendments once they are brought in committee today and throughout the process.
Thank you.
All right, so with that, it is 1 o'clock and we are going to wrap, but I wanted to thank everyone today. I wanted to thank all of our guests and folks from DOI who came here today and helped folks understand what this bill is about. And we're really excited to get it across the finish line and make sure that, again, we're helping people save money on their prescription medication. So thank you again. And please know that we are here if you need anything as the bill sponsors. Thanks.
Thanks.